Please be seated. Your Excellency the President, the Honorable Vice President, Cabinet Ministers and Deputy Ministers present, the Country Manager, World Bank and his team, distinguished ladies and gentlemen, good morning. Before we commence the program proper, may I invite everyone to observe individual quiet reflections with a minute of silence prayers, please. Amen. Amen. Your Excellency, improving maternal and child health has always occupied a special place in your heart, not just because you are the President, but also because you are a caring father. Therefore, it is neither a coincidence nor a fortuity that this morning we are here for the formal launch of the Sierra Leone Quality Essential Health Services and System Support Project. As you will later learn in more details in the course of this program, this project is intended to improve the quality of maternal and child health services in 5 selected districts. On that note, I will now invite Dr. Francis Smart for a brief background of the project.
His Excellency, please permit me to stand on existing protocols. The Sierra Leone Quality Essential Health Services and Systems Support Project aims to address the challenges that impede the achievement of universal health coverage, thus contributing to the implementation of Universal Health Coverage Roadmap for Sierra Leone 2021 to 2030, launched in December 2020 by His Excellency the Vice President, Dr. Mohamed Judejal. The project's goal is to increase utilization and improve the quality of maternal and child health services in 5 selected project districts, namely Bon, Kailam, Falaba, Tonkolili, Western rural districts. These districts were selected based on high risks related to maternal and child mortalities. By the end of this project, it is estimated that 2,084,555 people, including 1,359,000 women, females, in the 5 targeted districts would have received essential health and nutrition services, and 1,272,280 children would have received immunization services, and 81,201 deliveries conducted by skilled birth attendants. There are 4 projects components through which the Ministry of Health and Sanitation will implement the hubs and spokes service delivery model to improve essential health services to scale. The first component covers improving quality, efficiency, effectiveness of reproductive, maternal, newborn, child health, and nutrition services. The second component addresses strengthening national level health systems. And component 3 focuses on project management, monitoring, and evaluation. The 4th is the component contingent emergency response project, referred to as the $0 component. The project development process led by the Ministry of Health and Sanitation was consultative and inclusive across related programs, directorates, ministries, departments, agencies, underpinned by the strategic objective of the government of Sierra Leone as articulated in the Medium-Term National Development Plan 2019 to 2023 to address the country's health sector challenges. The project was negotiated and the negotiations were led by the Ministry of Finance. The Ministry of Health, in partnership with partners in health, to deliver on the service delivery component, counting on the improvements in health outcomes in Kono District achieved working in collaboration with PIH. The project is designed to ensure that implementation takes place at the district level using the hubs and spokes model of service delivery. PIH will provide technical backstopping on hubs and spokes model in 5 districts through coaching and mentoring on critical elements of health systems strengthening for upscaling interventions and sustainability. So, dual capacity of the project implementation and fiduciary arrangements were also designed. The Directorate of Policy, Planning and Information is responsible for the project's technical implementation coordination, coordinating and reporting to the Ministry's political and technical leadership. The Integrated Health Management Administration Unit within the Ministry of Health, which has considerable expertise in managing donor funds, is responsible for the fiduciary management. Additional required structures and technical capacity in procurement, in financial management, in environmental and social safeguards, monitoring and evaluation, internal audits, governance, accountability at national and district levels have been established and strengthened. All programming and implementation tools, instruments, general agreements, financial agreements, cooperation agreement documentation, including project implementation effectiveness conditions, have been prepared and deadlines met. And thus, this day, we launch this project. Thank you for your kind attention. God bless.
Thank you very much, Dr. Smart. We'll then proceed by inviting Dr. Mohamed Bayrobari for a brief remarks as the Executive Director of Partners in Health.
Excellency, Mr. President, permit me to stand on existing protocols. My name is Dr. Mohamed Bayrobari. I'm the Executive Director of Partners in Health Sierra Leone. This project is personal to me because growing up as a poor kid in the north of the country, I saw how devastating and how we suffered into getting healthcare. So it's personal, and this project is huge, which means millions of women and children will have access to quality healthcare. I started with Body Alliance in Kono District, working side by side with the government, with the Ministry of Health, with the DHMT, that later on integrated with Partners in Health as Partners in Health in Sierra Leone. So I started working in Kono in 2006 after founding with Body Alliance. I went abroad to study, but the urge to want to give back to the country, the urge to want to help support the healthcare system in Sierra Leone brought me back to Sierra Leone. I met PIH some years ago and was able to convince their founder, who is late now, and may he so rest in peace, to come to Sierra Leone. They came during Ebola. We worked during emergency and then settled down to go to Kono, where the organization I founded, Body, is to do health system strengthening. And we have a model that we call the 5S model in health system strengthening. 5S means staff, space, systems, and social support, which means in every facility we go, we ensure that we put the right amount of staff in the facility. We ensure that we supplement the supply, which is the stuff, the supply, the medications, and the equipment in that hospital. We ensure that we provide space, which is like we provide electricity, water supply. If there is no pharmacy, we build a pharmacy. If there is no lab, we build a lab. If there is no, whatever is lacking in terms of space for people, for clinicians to have space to provide, to do their job, we do that. And we build systems of monitoring and evaluation and reporting. And then we also provide social support to vulnerable patients. And putting all this together brought us certain results in Kono that led to this project, for the government invite us to ask us to be part of this project. And these are like, in the 2-3 years we worked in Kono, we increased the medically necessary cesarean section by 26%. We have 0 maternal death in Well Body Maternal Center for the past 5 years. We have over 3,000 deliveries in the facilities that PIH supports to 2020. We reduced stillbirth by 86%. And we increased access to family planning by 96%. And then increased adolescent and child-friendly clinics. We increased attendance by 335%, which is huge. And then, which 25% of these children that access this facility are below 20 years, which means we're in line with reducing teenage pregnancy and supporting the adolescent and youth-friendly clinic. I'm humbled and honored to be part of this project, and I commit Partners in Health to work closely as we used to, side by side with the Ministry of Health, with the DHMTs, and with the government to ensure this project is successful. Thank you.
Thank you very much, Dr. Barry, for the enormous work that you do in Partners in Health. Your Excellency, for us also to achieve the monumental aspirations of reducing maternal and child health, financing is very critical. And therefore, it's my pleasure to invite Dr. Abdul Muwonge, the Country Manager for World Bank, for a brief remarks.
Your Excellency, the President of the Republic of Sierra Leone, Dr. Julius Madabio, Your Excellency, Vice President Mohamed Jallo, Honorable Ministers, members of Parliament present, colleagues, ladies and gentlemen, it's a pleasure being here this morning. And congratulations, Your Excellency. Congratulations to the Honorable Minister of Finance, and Minister of Health, and of course to the people of Sierra Leone for this remarkable achievement. This project is so critical and it's so important in advancing the aspirations of the country to realize the universal health care objectives. When I learned about what PIH is doing in Kono, I was actually very fascinated and encouraged. We called them at the bank office to make a presentation. And we truly believe that the kind of transformation they've been able to implement in Kono, if scaled up in the next couple of districts supported through the project, and subsequently to the other districts across the country, is going to be a true model that will transform this country. And so, again, kudos to the ministry and everybody involved. It's a huge project, and let's work together to see that we realize its intended objective. Your Excellency, on behalf of my colleagues, we would like to reassure you of our support to the health sector. It's in line with the National Development Plan, where we know under your leadership, strong commitment has been put towards improving human capital development in the country. We still recognize, yes, Sierra Leone has a low human capital index, but every effort to improve this really is appreciated. And I was looking through this report, Your Excellency, which I would recommend they bring to your attention. That is the Sierra Leone Public Expenditure Review, specifically reviewing the chapter on health. And already you can see improvement across specific indicators. Just to mention a few, the proportion of births attended by skilled health personnel in Sierra Leone has increased from 42 to 87 between 2008 to 2019. And I'm quoting data from the DHS, the most recent available data. Adolescent birth rates per 1,000 women in the age bracket of 15 to 19 has reduced from 142 to 102, of over the same time period. Malnutrition among children under the age of 5 has actually reduced from 10 in 2008 to 5% in 2019. That's huge achievement, and we know a lot can be done. But how will this be done? This will be done, again, Honorable Your Excellency, the President and the Honorable Members of Parliament and Ministers present. In this report, you will find the policy metrics. But everything that is being talked about is actually in line with what the project is trying to advocate. And I think we are on the right track with the support of this project. We need to improve resource allocation and expenditure management in the sector. We need to improve efficiency in the health facilities. We need to improve the allocation of resources to primary health care, which is exactly under the focus of this project to strengthen district level interventions. And finally, we need to improve systems delivery by ensuring regular supplies of medical goods and services at all levels of the district level healthcare system. So when I come back to the project and what the overall objectives are in the healthcare system, I truly believe that if we continue the path we have established through our existing World Bank portfolio on health, supporting the government, this new project is going to leverage what already the government is doing, and we'll be able to realize improvement in maternal and child health care big time. I have no doubt Your Excellency, the President, on that particular objective. And I would like to end my remarks on also a reflection which the Minister of Health and Sanitation always reminds me when I visit his office, that every penny has to count. Every penny has to count. That's your slogan. Every time we talk, you say about, you repeat this. For me, I look at Sierra Leone as being blessed. When I look at a few countries within the region, a $60 million project is huge. Other countries will be struggling to think about partitioning the same $60 million across 4 or 5 sectors, Your Excellency. But here we have $60 million dedicated towards one specific sector. So the challenge to each one of us is to say, how are we going to make this money stick? What impact are we going to see and the transformation? All the indicators I've mentioned and many more. I think truly with the leadership and the support, we can achieve this. And once again, congratulations, Your Excellency, the President of the Republic of Sierra Leone, and colleagues. And to my team, can you stand so we can give you a round of applause? So that's the team from the bank side who have been working jointly and closely with the government team to deliver the project under the leadership of Kofi over there. Your Excellency, thank you very much.
Thank you very much, Abdul Mwonge, the country manager for World Bank. Your Excellency, there's always been one man, one person, who is translating your ambitious vision for the health sector into tangible actions. And therefore, it's my special privilege to invite the Minister of Health, Dr. Austin Dembi, for brief remarks.
Thank you very much, Kex. His Excellency, the President, Brigadier Retired, Dr. Julius Malaville, the Honorable Vice President, Dr. Mohamed Julde Diallo, Abdul Mwenge, the Country Manager for the World Bank in Sierra Leone, my new best friend in the country, and other representatives of the World Bank, the Executive Director of Partners in Health, members of the Diplomatic and Consular Corps, development partners, members of the Press Corps, distinguished ladies and gentlemen. It gives me great pleasure today to be here at the official launch of the Quality Essential Health Services support project called QSEP, an important Government of Sierra Leone-led project that's funded by the World Bank. His Excellency, thank you for your continued leadership. You made the bold move of making human capital development the principal foundation and the platform for our national development. We strongly support the vision that if we invest in education, health, agriculture, and infrastructure, together with other institutions, we will create a nation we are not only going to be proud of today, but will bequeath to generations unborn a vibrant nation where everyone has the opportunity to be the best that they could be. Since your election in 2018, we are seeing that dream come to reality. Today marks a major leap in that direction. His Excellency, since you appointed me Minister of Health and Sanitation a year ago, I have worked tirelessly with the incredible team at the Ministry of Health and Sanitation and our development partners, including the World Bank, to not only make significant gains in the health indicators, but doing so with a renewed focus on patient, client-centered care. No longer will the bulk of our projects be evaluated based on daily meetings or workshops held or the amount of expended DSAs. We will be evaluated on health outcomes, patient-client satisfaction. We will be monitoring these health trends on a weekly, monthly basis based on geography, catchment area, and disease burden. His Excellency, we want you to see significant changes that will bend the curve in our glide path to the end of the SDGs in 2030. Barely 8 years left from now. Minor cosmetic changes are not going to help us achieve the desired bold goals. Bold actions now to reduce maternal mortality from the current 717 per 100,000 to less than 300 per 100,000 in the next 2 years are the kinds of illustrative examples we're aiming for. The World Bank's action today, together with Government of Sierra Leone investments and that of our development partners, sets us on a path of realizing collective vision of the health sector of Sierra Leone. His Excellency, distinguished guests, this year, the year 2022, launches the year of urgent delivery for the health sector. On that note, I have messages for 3 audiences today. 1, to the World Bank. 2, to the staff of the Ministry of Health and Sanitation and our development partners. 3, to the people of Sierra Leone, to His Excellency, the President. To the Bank, I want to say a big thank you for believing in our national vision and the implementation model that entrusts accountability to the Ministry of Health and Sanitation with delegated responsibility to partners in health. It is even more profound to know that we're receiving a grant of this magnitude and not a repayable loan. We want to publicly assure you that every Leone and cent provided in this grant will be used for the intended purpose. We will insist on efficient and effective systems that will assure value for money. We will ensure that there are fiduciary and internal controls that have zero tolerance for fraud, waste, and abuse. We will focus and insist on patient, client-centered care and health outcomes. To our MOH staff and development partners, the model of exhaustive consultation with MOH's leadership throughout the project development process, resulting in the launch today, is a model we should all emulate. The ambitious goals set forth in these plans are not ceilings, but floors that we should consider as we set our individual targets. The plan calls for all hands on deck, following a coherent national direction. Complementarity and synergy with other projects and programs in development are critical to achieving our ambitious goals. No project in the health sector will be an isolated island. We will make sure that every effort is made to connect all projects using client, patient-centered approach to get the desired health outcomes that will truly move the dial in our sector. Our new bosses are the patients and clients we serve. To the people of Sierra Leone, through His Excellency the President, we want to publicly state that you should hold the Minister and the Ministry of Health and Sanitation both responsible for and accountable for these resources. Our approach to using these and other resources will be based on patient, client-centered care with a distinct focus on health outcomes. Thank you very much.
Thank you very much, the Honourable Minister. As I did say earlier, the man who transforms the President's vision into tangible action. Ladies and gentlemen, to transform every nation, you always have a leader who is inspiring, transformative, bold, and committed to the service of his people, especially vulnerable people. Therefore, it's now my unique opportunity to present His Excellency the President for a response and formal launch of the project. Your Excellency, sir.
Thank you very much, the Honorable Vice President, Honorable Ministers of Government, representatives of the World Bank, Executive Director, Partners in Health, distinguished ladies and gentlemen, good morning. I want to start off by thanking the World Bank for sharing and supporting our vision that's strengthening the health systems and improving health service systems and improving health service. We made it in our manifesto that development is about people, and no meaningful development can take place in any nation without the development of the human capital first. Part of that involves improving healthcare, protecting poor and vulnerable population groups. We were mindful of health disparities and moved by the poor state of achieving universal health coverage with concrete actions, including increasing healthcare budget, recruiting and training more healthcare staff, restructuring our healthcare section and building healthcare facilities, and improving access to and affordability of healthcare across the country. Some weeks ago at York, a village not too far from here, but just around the hills, we introduced a Health on Wheels initiative to take healthcare into unserved and far-to-reach communities of this country. By taking healthcare services within a 5-mile radius of every Sierra Leonean, we have improved health outcomes and lowered disease burdens. Maternal and infant mortality are down, and we will work to reduce them even further. Vaccination rates are higher now. Malaria kills far fewer Sierra Leoneans now. More persons living with HIV and TB are receiving life-saving medication today. We have strengthened disease surveillance teams, and we have quickly and effectively responded to potential epidemics. We have successfully fought against successive waves of COVID-19 to much international acclaim, I must add, keeping fatalities to the minimum. In all of these, we have been intentional, inclusive, and innovative, knowing that each Sierra Leonean deserves to live a healthy life and contribute his or her fair share to our nation's development. So I thank you, our development partners, who have believed in us and believe with us that our goals are achievable. You have generously supported our shared aspiration for our people with technical expertise, equipment, and grants. Thank you for supporting us. Of course, previous speakers have laid out the scope of the project from various perspectives. This project concretizes our ongoing development partnership with the World Bank. It also enhances our partnership with partners in health, Sierra Leone. We are engaging them to replicate the Kono model in Kailam, as well as support other 4 districts to achieve the same impressive outcomes. Partners in health, thank you. As I've indicated earlier, we are intentional about our interventions. We have looked at the data and looked at the comparative poverty rates. We have selected areas within high poverty rates: Ons, Falaba, Kailam, Tonkolili, and Western Rural. For those who speak in terms of regional distribution, that is to say, those who are always being political, the two districts in the north, there are 2 districts in the north, 1 in the south, 1 in the east, and 1 in the west. Fair distribution across the country. Additionally, we consider that these areas shared one or more of the following: high disease burden, high number of deliveries, geographically hard to reach areas, large number of patients, large catchment populations, high population with high healthcare service utilization. In addition to the foregoing, Falaba was declared a district by the previous government without a district hospital or district health management team office. Since 2018, we have had to develop new health systems for that district, and we are working hard on that. We will soon pronounce the result of our effort for the good people of Falaba. As I indicated, the project is intended to address high levels of maternal and child mortality in Sierra Leone in the beneficiary districts. So the primary beneficiaries are women and children. This grant will be used to finance a hub and spoke service delivery model. We will identify hubs in each district cluster and then distribute and improve quality essential health services at each of these satellite stations. The following district facilities will be upgraded as hubs. For Bond District, the UBC Hospital in Matru, Moriba Town, the CHC in Moriba Town, CHC in Tihum. Tihum is a city, it should be added that. For Kailan District, Bandajuma, Yahweh, Bwedu, Chojima. And for Falaba District, we have Kumbola, Falaba, and the CHC at Mongol. For Tonkolili, CHC Hinista, CHC Masingbi, and Bendugu. For the western area, Waterloo and Godrich. We intend to achieve a number of goals with this project. First, we want to ensure that skilled health personnel are available in target districts. Second, pregnant women should attend antenatal clinics at least 4 times at all deliveries, and all deliveries are attended to by skilled health personnel. Next, we want to ensure that children are fully immunized. Finally, all mothers and children should receive basic nutrition services in health facilities. Therefore, we intend to invest this grant in a number of core areas in order to realize our project outcomes. For staff training, we will strengthen academic staffing, review curriculum, and establish a formal affiliation between the University of Sierra Leone and the McKinney School of Clinical Sciences, Food Department and Health Department, and Midwifery School. The grant will also help the government of Sierra Leone finance and expand ongoing training of general surgery students, including ensuring full accreditation for postgraduate training, medical surgical nursing, midwifery, and pediatrics, and also other relevant fields. We will also enhance our recruitment and training initiatives. At the community level, first aid kits will be supplied to selected schools in Bond, Falabar, Kailam, Tonkolili, and Western Area rural districts. Teachers will be trained in basic health care skills to allow them to treat first aid cases that occur in schools. For infrastructure, we will construct the 14 health facilities designated as hubs and spokes. We will also ensure the provision of laboratories and medical equipment and supplies. We will also apportion some amount for supporting operations of the National Ambulance Services. The project will also pilot an eco-friendly, centralized biomedical waste treatment facilities in Western area, Western urban and Western rural districts in Freetown area. At the operational levels, we will install facility level management information systems that will enhance the development of integrated clinical processes, data registry, digital forms, and other documentation. As a consequence, digital patient files will be generated to inform clinical decision-making as essential parts of the electronic medical records system. Critical to attaining universal health coverage is sustainable health financing. The project will support the Sierra Leone Social Health Insurance Scheme that will drive the objective of making healthcare available across the country. The grant will also support the local production of affordable, nutrient and protein-rich foods, including Benimix. This enhanced protein-rich food will support the growth of malnourished infants, children under 5, pregnant and lactating mothers, and other vulnerable adults. Distinguished ladies and gentlemen, I will end my statement by thanking the World Bank again for their generous support. We also anticipate to work effectively with partners in health over the next 5 years as we implement this project. As I've always said, human capital development will drive and accelerate sustainable development in this nation. We will pursue that objective with purpose. Thank you for your kind attention, and I now formally pronounce receipt of a grant of $60 million United States dollars from the World Bank to the Quality Essential Health Services and System Support Project. Thank you.
Louder round of applause. Thank you very much, Your Excellency the President, for such a reassuring message. And it's also important, permit me, Your Excellency, to re-echo that the selection of the districts, two in the north, one in the western area, one in the south, one in the east, demonstrate that your leadership has always been about inclusive governance. Another round of applause for His Excellency the President. His Excellency has also kindly consented for a photo opportunity, and we'll have two sets of photo opportunity that we'll be having today. The first will be His Excellency the President, the Honorable Vice President, the World Bank team, and the Minister of Health. And then the second will be His Excellency the President, the Honorable Vice President, the World Bank team, and then officials of the Ministry of Health who have also worked so hard for this project, and ministers and deputy ministers present. On that note, may I now invite all of us to stand for the national anthem. Partners for Health this week. Special instruction of His Excellency the President, partners of health, you will be in both photo opportunity. Partners for health, partners in health will be in both opportunities for the pictures. May I invite the World Bank team, the ministers, partners in health, and officials of the ministry to make their way to the lawn for a photo opportunity.
Live from State House this morning, and as we all know, His Excellency just launched the Sierra Leone Quality Essential Health Services and System Support Project. Of course, this now is $60 million World Bank project. We, the World Bank, definitely give to Sierra Leone, for we look at we health service now this country. We all know the importance of health service. The importance of the health service as Sierra Leone, of course. This project, they give you vivid explanation about a lot of things for happening in the health sector. And this now under the Ministry of Health and Sanitation, and the project now Essential Health Services and System Support Project, and call them QHSSP. President been talk a lot of things in his speech that this morning grant, because grant you're not going to pay again. Now money we then give you for learn we develop health services, so that at least we're going to look at all areas in terms of health services. And we all know how the health business is very essential in this country. So if World Bank don't decide to give you that money, they go for look at a lot of aspects in the health services. You go for look at training, you go for look at equipment, you go for look at infrastructure, you go for look at the services, you go for look at even the patients, the service that we give to patients them. Therefore, look all that, because very, very important. The money very huge, $60 million United States dollar, huge money. So it's a money we are going to make sure they manage them in a way whereby I mean, we will see the effects on the citizens of this country. So, President, we mentioned a lot of side and way and go for look, you know, for in terms of this money, because you talk about infrastructure, you talk about how the 14 districts, 16 as a whole, that you will get health facilities, we get all the things that we're supposed to get, so that at least then go able for impact the people of this country, and also even go to the extent, say, go train, even teachers them for know how, then go able for implement health service, you know, to the nation. So with all that, we for no say it is very, very important that we health services. Doc. So at least, well, I got Dr. Leone, yeah? Dr. Barry, sorry, Dr. Barry. What are you representing?
Partners in health.
Okay. Now, I agree you, of course, you play a very important role into this launching of the essential health services. Now, tell me how this will really impact the citizen of this country.
Yeah, so absolutely we believe, say, this project go reach millions of pregnant women and picking them across the country, because this hub and spokes is like when you develop one facility very well, you put all the ingredients, the way they make them function, then other staff them from the other facility, then they can there and access healthcare. So each of the districts they will get for support 3 clean facilities that they develop to that level there for provide healthcare across the country. So I believe, say, with them 14 or 15 clean facilities that they already develop, then will definitely create a huge access to maternal and child health services in the country.
Okay, you will say this is one of you baby, because of course you always the thing say health, essential health, people are supposed to forget them because by your background, what you say. So you feel to say this really will go for Siam, the effect that they could touch everybody.
So absolutely, I strongly believe, say, with the commitment from the Ministry of Health and the commitment from the government, working with we together, we will create a huge impact. And as we get some discussions with the World Bank, whatever, they're really willing for support for move this. And with the commitment from the ministry and the DMOs then who they work with in the district, we believe, say, we will create a huge impact. Like example, the impact will create in Akono is huge, that if we also do the same thing at other districts, it will be a good format for the country.
All right, thank you very much, Doctor. Thank you. I appreciate you. Well, of course, I get, of course, we, you can always, now somebody, you know, in this health business for quite a long time. It's only now few Sierra Leoneans know him as somebody in the health service, but this minister, this doctor, they don't need to tell you Ebola been there, and a lot of things anyway they don't do. So, I mean, the president no miss for choose him as the Minister of Health, because they always try to make sure, say, people health service, Sierra Leoneans and get them. So this is one key. So I want to welcome you to SMBC, Dr. Dembi.
Thank you very much.
Now, today, of course, I can always key focus is now for let we get essential health service. And of course, I remember the last time we were in New York, you know, and then mobile clinic. We know one other area for reach the people. Now today, we are also for launch. Of course, President already launched the quality essential health services and system support. What did this mean to Sierra Leone?
Well, when you get idea, like where the president gets nobody not for left behind, for really able to provide health services for all men in this country. Now that's not the true meaning of universal health coverage. Well, for do that kind of work, first you need to forget the ambition, you need to forget the people, you need to forget the plans. But you don't pull all on it together, you need the resources. So the World Bank can give you $60 million gratis as a gift to Sierra Leone because they believe what you want to do. So what you do go do now? Then 5 districts here so will be active. One show say you go able for access good quality health care. Now they decided nobody know for they will get for left behind. Nobody know where they will need health care. We know able for access that kind of health care. And we don't do that. And they make sure say that then 6 districts here so active. We make sure say the rest of the 11 districts they are not left behind. They actively work there as well. But here's a good model for start.
Okay. Now, in your speech, you mentioned 3 segments. You talk to the World Bank. Of course, you talk to government, and you talk to the people of Sierra Leone. I want to let you integrate again them points in the way what's the importance of it.
So again, we money like this come, importantly the money get purpose. We money like this come, importantly waste not the panel. The efficiency the inside. You make sure say if you get the 1 cent, you get the value of that 1 cent there. So it's me want to assure people and say, I work very closely with the Ministry of Health. We work very closely with partners in health. We work very closely with the community for make sure every penny we are associated with this project here, so we use them for the people and service. And as soon as that kind of commitment I make to the people them publicly in front of the president, in front of all man, say, me as minister and me one whole ministry, will take responsibility, will take accountability for the resources or for use and for the people that we intend for.
Even when you say this, you must get some people that will actually go to think otherwise.
Yes.
Yeah. And this money definitely will think about wastage, fraud. People that we obviously would think otherwise.
Yes.
Yeah. But you're not going to do it.
We're not getting a chance. We're not getting a chance because what's going to happen, we build internal controls. We make sure say every 1 penny we go out, we know which side they go, we know how for use them. We know say get the kind of results. Again, I emphasize say with this new project, we know they just go no more for say we don't write new policy, we don't get new workshop here, we don't get new meeting and that. With the focus on health outcomes, with the focus on patient-centered care, client-centered care. At the end of the day, we make them very clear or remind we all, say we boss them, not the patient, we boss them in the community. That then go tell we if they do well or not they do well. So when this resource here come to a clinic or a site near you, at the end of the day, we get to go look, say, how the good people that we get this, how they work for provide services. At the same time, we'll ask the people how this service here, how they feel about them. And if we see say disparity, we'll go inside it and correct them. We're not wait say 1 month, say 2 months, say 1 year for find out what's happening. We get constant monitoring, week by week. We see the real data where they come from a national level, from the district level, from the chiefdom level, from the neighborhood level. So the suicide disparity and the suicide problem today, we're not wait like a fester, they go fix them right away.
So now the project on launch now, saying feasibly we will begin to see will go impact the people.
Well, this is not the first time we they launch this kind of project here. So usually the project they launch, they wanna go begin make the plans for how for implement them. That's not the case. This is not the first time in the history of this country in the bank's engagement here, where on the day of the launch, you get the implementation plan ready. So now, very, very soon, we're going to all of them 5 districts here, so including Kono as well, for go see which are the modalities for translate this into actual action on the ground. So again, not too far from now. In the next couple of weeks, you begin to see a team and they move around. And from this launch today, they begin to disperse the funds fairly soon. Again, what's that? This is no more. This is not money for the people. This is not money for the people in health. And we want to see this money now the health service delivery points.
Just send a last word, strong warning to when we have a deal with them for make sure say it reach.
Yeah. Well, I get real confidence in the Ministry of Health people that I don't work with so far, what they work with. And within the health sector, you get very good people. You get very hardworking. You get people that really care about the patient and about the community within they serve. At the same time, not a perfect situation. You get some people that will draw you down. Waiting with they say now, we get for identify them and then they will draw it down, pull them aside. This money also we get ACC day all over them, including myself now. So again, I don't want to let we get distracted with that because I think so you get good people there, so we're really ready for utilize them for here, so for the benefit of the people. And again, one good partner will see this way. So if we make mistake, we'll let we know. We will correct them.
All right. Thank you very much.
Thank you, Dan.
I appreciate
Thank
you.
you, Dan.
Thank you, sir.
Thank you.
All right. Dr. Dembi, of course, he now the Minister for Health, and explain exactly the essence of the launch of this program with His Excellency just launched. Well, I think to say we'll get a break now because we don't get talk to the essential people in this program. But this one, it will be a good program. We World Bank the sponsor, and we hope say definitely the people of Sierra Leone could benefit from this. Until then, thanks to my cameraman David Williams and the technical man Alex say, we wish you a pleasant morning. We'll go for join back in the afternoon later.